So next we have that which precaution has not been shown to reduce the risk of HIV transmission during surgery. Would it be gloves, double gloves, protective eyewear, laminar flow ventilation, or surgical masks? So, out of these, there is one feature which has not been associated with the decrease in the risk. However, rest are the parameters which should be upheld to prevent the HIV transmission. So, in this scenario, the laminar flow ventilation, because HIV does not have any airborne contamination or airborne risk, it will not be having any influence on its transmission. So, standard universal precautions against blood-borne viral infection includes gloving, that is number one. Ideally, should be double glove with an indicator. Then we have the gown. Then we have the surgical masks. Will also require eye protection, specifically goggles, because in orthopedic procedures or any surgery which requires some aggressive steps, there might be some bony pieces or any blood component flying anywhere. For that, eye protection is the most important thing. Now, these measures will protect against the blood and the body fluid splashes and needle stick injuries. However, laminar flow ventilation reduces the airborne particles. So, if this same scenario is asked with reference to anything that has an airborne spread, then laminar flow ventilation will be an effective way in reducing its transmission. So, uh, but HIV is transmitted by the blood to blood contact, so not by the airborne. So, laminar flow will not have much impact, rather, no impact on the transmission of the HIV during the surgery. So, what are the universal precautions? That is the gloves, gown, mask, and eye protection. Double glove with an indicator system is the best protection. So, you could be tested that which one of the following is the best or the ideal procedure or the gold standard for needle stick injuries. That will be double glove with an indicator system. Now, HIV is a blood-borne virus, not airborne, so laminar flow will be irrelevant to prevent its transmission. Laminar flow, however, reduces surgical site infection risk in prosthetic or orthopedic surgery. So, there it has its role, but not in the HIV. Needle stick injury is most common surgical HIV exposure risk.